So I'm Tori, and I'm going to give you a short presentation here on Meniere's disease. So Meniere's disease is a complex progressive disease of the inner ear labyrinth. Here in this picture, it is this purple region. It's typically as fluid builds up in the cochlear area of the inner ear, and it also can affect the cochlear nerve. This is an idiopathic disease where the doctors don't know really what caused it, but in most cases it's only a unilateral disease as opposed to bilateral, whereas it can be the same. Here I have the definition for unilateral vestibular hypofunction. This term is used to describe the balance system of the inner ear when it's not working properly. So, signs and symptoms are recurring episodes of vertigo, hearing loss, tinnitus, which is ringing of the ear, feeling of fullness in the ear, that's due to the water or the fluid that you can feel. So the onset of this can occur typically in young to middle-aged adulthood. And then moving on, there is a more serious form called Termichen's autolytic crisis, or commonly easier said as drop attack. And this is when a person consciously falls to the ground without any warning. They can stand up as quickly as they fall down. They're not really sure what causes this one as well, and it doesn't always affect everyone who has Meniere's disease, and it sets in later in the lifespan of having it. So here I have a short video of drop attack. It's only about 45 seconds or so, if I can click it. And it shows how it is very, It shows that it can come on really quickly, and that you have to kind of be more aware of your surroundings, because it kind of shows how the guy holds his head, and you can have other repercussions that come from actually just falling. So then he slowly starts to get up, kind of gets his orientation back together. So back to the PowerPoint. Ways to manage are they say to eat about 2 grams of less of sodium a day, to avoid caffeine and excessive alcohol and tobacco use, as those are typically stimulants. Pharmacology is they might prescribe motion sickness medications such as mescaline or diazepam, or easily known as Valium. This helps reduce the spinning sensation and help control nausea and vomiting. The anti-nausea medications such as promethazine to help control the nausea and vomiting during the actual episode. The possible use of diuretics, which would be the fluid retention happening in the ear, which is also why you would decrease the sodium intake. You can have shots to your inner ear, such as the gentamicin, which decreases the balance function affecting one side. So that would completely cut out potentially hearing and the balance on, say, your left side, whereas your right side completely takes over. You can do a steroid shot such as dexamethasone and cortisone, and those can help control your vertigo attacks. Surgeries can include the endolymphatic sac procedure, where this sac is decompressed, and that actually plays a role in regulating the inner ear fluid levels. And in some cases, they might put a shunt in your ear to help with the fluid drainage. A labyrinthectomy, where the surgeon removes the balance portion of the inner ear, and this means both hearing and balance are taken away. They try to do this if they have near total or total hearing loss already, because they don't want to take it away. The vestibular nerve section is where they cut the nerve tract that connects the balance and movement sensors in the inner brain, and it usually corrects the vertigo problem while attempting to preserve hearing in the ear. So what can the PTs do? Gaze exercises. This is to help improve the vestibulo-ocular reflex and the other systems used in gaze stability with head motion. This is in case of retinal slips, which is where your vision will become blurry. The postural stability exercises to help improve balance by encouraging balance strategies within the patient's limitations, be it the somatosensory, so your musculoskeletal or neuromuscular components, visual or vestibular. Habituation exercises are warranted when a patient with UVH has continual complaints of dizziness. The habituation is defined as the reduction in response to repeatedly performed movements. To determine these exercises, the PT must determine the provoking positions first, and then when they find the position that elicits the mild to moderate response, the patient should remain for 30 seconds in that position or until the dizziness subsides. Here they typically give a lot of the home exercise programs so the patient can begin to orient themselves, and they'll have you do these for about 2 weeks, and if it lasts longer than 2 weeks, then you will come back in and be reassessed, or they'll recommend you go see your physician. And then there's the treatment of disequilibrium occurring after like your vestibular nerve resection or the labyrinthectomy, and the disequilibrium is one sensation of feeling off balance. So, one interesting fact is this week, September 20th through the 26th, is actually considered Balance Awareness Week, and Meniere's is included in like the celebration for this kind of week, so it's kind of pretty cool that my project is due within it. And then personally, I do have a friend who was diagnosed with Meniere's disease, and she started off with a unilateral one, so she was very cautious and everything with making turns to her left side. She has had both forms of the shots and the sac reduction, and after she had all of that, and I think within last year or the year before, she was diagnosed as actually having bilateral Meniere's disease, and as far as I know, yet to have a procedure done on her right side, but she doesn't want to completely lose out on being able to do something as simple as turning. Here are my references.